Hello, ladies and gentlemen. My name is Murad Karadsheh. I'm a surgery resident from Einstein Medical Center in Philadelphia. I'll be presenting early postoperative outcomes in implant, pedicled, and free flap reconstruction for breast cancer, an analysis of 23,834 patients from the ACS-NSQIP datasets. This study was conducted in affiliation with the Division of Plastic and Reconstructive Surgery at Fox Cancer Center and Temple Health University. Patients continue to seek breast reconstruction following mastectomy for breast cancer. However, debate continues to exist regarding the best reconstructive option. The authors evaluated outcomes comparing implant, free flap, and pedicle flap reconstruction from the NSQIP database. A retrospective analysis from the 2011 to 2016 NSQIP database was performed of patients who underwent mastectomy for breast cancer. Sociodemographics, preoperative risk factors, baseline comorbidities, and intraoperative risk factors were identified. Primary outcomes within 30 days included wound-related, infectious, and overall medical or surgical complications. The patients were then divided into three groups based on the type of reconstruction. This included implant-based reconstruction, pedicle flap reconstruction, and free flap reconstruction. In our statistical analysis, sample characteristics were summarized with means, standard deviations, and proportions. Logistic regression models were used for binary outcomes. A generalized linear model was used for length of stay analysis, and covariates were adjusted using propensity overlap weighting. In our results, 23,834 patients were included in the study. The mean age of the cohort was 51.7 years. Most patients underwent implant reconstruction at 87.7%. This was followed by free flap reconstruction at 8.1% and 4.2% who underwent pedicle flap reconstruction. In evaluation of intraoperative characteristics, most patients in all reconstructive groups were ASA class 2 with a clean wound class. The implant group had the lowest mean operative time at 206 minutes. This was followed by the pedicle group at 334.6 minutes and the free flap group at 506.2 minutes. In our logistic regression analysis, compared to our free flap group, the implant group had significantly less postoperative pneumonia, pulmonary embolism, urinary tract infections, postoperative bleeding, sepsis, venous thromboembolism, and return to the operating room. Compared to the free flap group, the pedicle group had less postoperative bleeding or transfusion requirements. And compared to the implant group, superficial surgical site infections, pneumonia, unplanned reintubation, pulmonary embolism, postoperative bleeding, sepsis, and venous thromboembolism were higher in the pedicle group. In our length of stay analysis, the length of stay was highest among the free flap group at 4.5 days. This was followed by the pedicle group at 3.8 days. The implant group had the lowest length of stay at 1.6 days. In conclusion, implant-based reconstruction has lower short-term postoperative complication rates and shorter length of stay than free flap and pedicle flap-based reconstruction. Implant-based reconstruction is the most common reconstruction modality for breast cancer. However, long-term studies should be done to evaluate outcomes among all reconstructive modalities. Thank you.